evening. We all know why we're here tonight. We've all borne witness to the harmful stain drugs can cause to our community. The heartbreak it brings to families who lose a loved one to the means of addiction. The devil is in the drug deals. As many adolescents or high schoolers can attest to, anyone can be asked to do or to sell drugs. How do we come together as a community to exercise those drug dealings once and for all? Tonight we'll examine the current state of the epidemic and what we can collectively do to find a solution and help all those who are affected. Our panel of experts tonight: Ocean County Prosecutor Joe Coronado, Ocean County Sheriff Mike Mastronardi, John Rogan, using his second chance at life to advocate for New Jersey's opioid overdose recovery program, Anthony Castellano, Vice President of Substance Abuse Services for Behavioral Health of Ocean County, and Attorney Steve Willis, co-founder of Ocean Flood. The discussion will be divided into 5 segments lasting about 10 minutes each, allowing our experts to elaborate on progress and challenges from their perspectives. Each segment will conclude with about 2 or 3 minutes of questions from you, submitted here in the Ryan Center or tweeted to us at WOEM. We ask for your questions to remain on tonight's topic. Any outside topics should be addressed with our panelists at a later date. I'd like to start with our first panelist, Sheriff Mike Mastronardi. There's no secret about the risk of the drug dealing, and yet there's always someone willing to get into the drug dealing business. What, in your opinion, is the reason or the reasons for why people are getting involved in drug dealing?
Okay, thank you. Thank you for having us tonight. Well, my experience of over 40 years in law enforcement in Ocean County is that a lot of people get into it because they've done the thing themselves. There are certainly the saying they do it for profit, and that's profit driven, that's will always be there. But there are a lot of people, good people in our county and in our state, that get involved just to basically pay their habit. I will say that my delay in getting here right now, my phone calls from the Ocean County Jail at this moment, because we have a young man at 3 o'clock in the morning, Thursday morning, I got a phone call from his father that he OD'd, and he's Narcan back to life thanks to the prosecutor and what he's done in our county. However, I knew this young man since he was 10 years old. He's 21. Currently, he's in the Ocean County Jail. As a result of his being Narcan, he's brought to back, but it's his 10th time being Narcan. 10th time. His father's in Mexico feeling a loss in how to communicate. We've had trouble for the last 2 days communicating. But his mother just called me. She was in Eastover. And she's pleading with me to keep him in the jail. She's afraid that he gets out, she won't have a son, and the father won't have a son. So it is a difficult situation for all of us, but it certainly hits home. And here's a young man that he has a $200 warrant at a local court that our sheriff's officers went and picked him up from the hospital to put him in the jail so he'd be safe. And that's what we're up against. It's a very difficult, and it's a very difficult situation in the camp.
What about for similar individuals like him who are becoming involved as a drug dealer or an addict themselves? What is that next step in getting them help? Is the best option jail at that point, or is it sending them to a place of rehab?
Well, I think really the one to address that would be the prosecutor, who's done an outstanding job in his tenure as prosecutor here, recognizing the problem, trying to help people, whether it be the Narcan program or having people come for assistance. I think he'd be the proper one to address that too. We just support him and his good efforts. I don't know if you want to do that, prosecutor.
Well, again, it's a real pleasure to be here, and I really thank all the people that came out tonight. I will tell you this: it's clear to me that taking somebody who has a substance abuse problem and placing him in the jail is not the way to go. I mean, you can kind of see for the last 30 or 40 years that we haven't succeeded, so we need to look to alternatives to try to solve this problem. I think that the problem that Mike just talked about, where you have this young individual, 21 years old, with 10 times being brought back from Narcan. I mean, obviously this is somebody who needs inpatient. This is somebody who needs to, change their lifestyle. As I recall, they need to break down the computer, reboot the computer, and try to get them back to be a viable member of society and to live. The source of putting that person in jail, I mean, that's, in my opinion, at some point in time, they're going to be released. They're not going to stay in jail for probably not all that long. And they're going to be facing that problem, and the jail can't help them per se to deal with what they're going to have to do out in the street. So what am I saying? I'm saying that, we need to come up with a solution, that law enforcement needs to partner up with healthcare to see the best way that we can to rehab these individuals and to get them to get their life back together. I do believe that in this instance, I mean, I'm not a clinician, but somebody needs to clinically look at that individual, break down an individual. I'm sure that there's more than substance abuse, maybe some mental health that needs to be addressed, and then have to have a holistic approach. And then I also think that after that person either goes into inpatient, whether it's 30 days, 60 days, or 6 months, whatever halfway house that they have, or whatever they need as they work through it, they probably need to have what I call a mentor. That's where the recovery coaches come in, where there's somebody where this person can mentor up with that individual, talk to that individual on a daily basis, meet with that individual, and get them through the humps of life, so that they don't fall back. So it's not an easy solution, but it's a direction that we need to go in.
Now, I'm sure that a prosecutor, you, Sheriff, can attest to that this may not be the only case of someone who's been repeatedly arrested for narcotics-related offenses or gone to rehab and or overdosed and relapsed again. I can't imagine there being any easy solution to finding them help, but is there any warning signs that even comes up in their own mind of how to overcome it?
Well, let me start with this. When I became prosecutor just about 4 years ago to the day, I guess it was the first week of being prosecutor, we had 8 overdose deaths here in Ocean County, all under the age of 28. And one young girl, blonde girl, who was living in Bricktown, who overdosed on 50 packs of heroin, 25 in the morning, 25 at night. She died in a motel room. And I knew as a father, as a dad, that we had to do something about it. As we went through the year, in 2012, we had 56 overdose deaths before I became prosecutor. The year I became prosecutor in 2013, we had 112. As I could see that it was doubling as going through, that's when we started taking a look at Narcan. We were the first county in the state to use Narcan. We started in 2014. But it became apparent to me that Narcan itself wasn't really going to be the solution. It took care of that person for that moment to save their life. There needed to be something that we need to do afterwards. We need to go out. We need to address it. And eventually that led to the OR program, which is a program that once law enforcement sprayed somebody in Ocean County and they're brought to a hospital, at that point in time, a recovery coach, an individual meets that person at the hospital, talks to that individual, and right then and there, as I call them, while the teardrops are warm, tries to gets them into rehab. Then they're taken from the hospital, they're taken to a detox facility, then they're taken from the detox facility into treatment. And that program not only worked here in Ocean County, but now starting to spread across the entire state through state funding and like. But then it came to the point where I said, wait a minute, if you have drug court, meaning if somebody gets arrested, we get to put them into treatment, and you have to overdose to get in treatment. The next step was to start what we now call HARP, New Jersey, which is I've got 2 police departments in Ocean County that on a Wednesday you can produce yourself to Manchester, on a Thursday you can go to Brick. And Anthony, I just have to give a shout out to Anthony because he handles my Thursday, but that's the behavioral health. What happens is you go to Brick on Thursday, they will then bring you over to Anthony. A clinician then will take a look at it, and based on their review and their clinical analysis, they will get them into treatment. And I'm proud to say that since we started that program on January 11th, that we have about 105 people that have been put into treatment so far. 90% of them. 90% of them have no money, and they're still in the program, and we find places for where they can go. The bottom line is, and this is shocking to me, how desperate must you be when you go to a police department looking for help because you have a drug problem? But, you know, I mean, you would think that there would be other places that they would turn up, but the fact is we're going to try to continue to expand that program and try to make a difference. At the same time, I just want to make it clear that I also believe that you know, that we need to go after the predators that are out there. So, I mean, I think our job as law enforcement, I've kind of broken it down into 3 blocks. One is the education and prevention blocks, where you need to go into the schools and start at the school level to prevent it from coming. The second block is strong law enforcement, and the third block is partnering up with the healthcare community to break the cycle of addiction. And I think that if you look at the program, and you look at one program which is maybe strict liability that we do, or if you look like the canines, or if you just look at the Narcan, that each individual program probably won't make a difference. But if you take the whole plan and put the whole plan into effect, you know, maybe then you have a shot.
I'd like to continue along the lines of the drug on one side, when someone is arrested, what obstacles are arising in following the money trail? I can start with you, Sheriff Mastronardi, following the money trail back to the source.
Actually, the prosecutor's the lead on that too. He has the investigation arm, of which we partner up with him with staffing as well as the lab. We run the lab in Ocean County. We do over 4,000 drug cases a year. And Dr. Wood, who's in charge of the lab, says in his 6 years, what he's seen is a dramatic increase in heroin and certainly fentanyl, which is a concern because that leads a lot to our overdoses. I think you'd agree with that, right, Prosecutor?
Yeah, I mean, I think fentanyl was a game changer. And I'll get back to the question, but fentanyl is a game changer. Back in 2010, 10% of our packets we had here in Ocean County had fentanyl. In 2015, it went up to 35%. Unfortunately, in 2016, 65% of the packets that we had here have fentanyl. And fentanyl definitely is a game changer. It's 100 times more powerful than morphine. And the bottom line is that a little bit of fentanyl will kill somebody. And that's why, unfortunately, in the year 2016, we ended up with 209 overdose deaths. So which is just unthinkable. So to get back to the drug dealer, I think the key here is that, you know, when either a local police detective or my detectives go in and arrest somebody, that to me is a moment where that person has to make a determination as to whether they're going to cooperate or whether or not they're going to just not say anything, which is their right, and then go to court. I think bail reform has had a little bit of effect on it in the sense that most people now know that if you get arrested, the chances are that you're not going to be going to jail right away. And law enforcement only works with leverage. I mean, if you have leverage, and to a certain extent, you know, bail reform has kind of hurt our leverage a little bit with regard to that. But I do believe the principles of bail reform are appropriate. I think that we need to look towards it, and we're just going to have to adapt to learn how to adapt so that we can go after those predators. I do believe that it's my job, and I believe all the law enforcement officers in Ocean County know that we can find the true predators out there and hold them accountable.
What about some of the drug deals going on the internet? And I know Sheriff that you're as well very into the tech and tech-savvy world as well, but the dark web, and you can answer as well, Prosecutor, the drug black market being run through the internet, drug deals being there, drug dealers trying to hide what they're doing. How can this be compromised, infiltrated, and ultimately rendered useless?
That's a huge problem. I mean, first off, there's kind of 3 levels to the web. You got the normal level, the horizontal level, you got the dark web, and you got the deep web that goes down. Bottom line is in the dark web, you can certainly order up your fentanyl and order up your heroin probably over the internet, and FedEx can deliver it to you. Bottom line is it's pretty sad, you know, when we find out that you can get fentanyl spray, you get fentanyl lollipops, you can order that, and then it'll come in from either Russia, China, or from anywhere, because everybody thinks that the web is only located here in the United States, which it's not. I mean, it's here in the United States, but it's all over the world, and other countries don't regulate it. So when you go offshore, it's pretty difficult. And with the amount of volume, you know, I give kudos to the government in trying to attempt to screen all that stuff, but I will tell you that it's a challenge. And it's a problem. I mean, clearly it's a problem. It's probably more on the federal level than it is on the state level, but I can tell you this, that it's clear to me that we've had college students who overdosed and died as a result of medication that they got over the web, and it's pretty sad.
Nationally, though, they say that the CDC, the Control Disease, says that 50% of our people that get addicted to opiates usually come from prescriptions by doctors. And to me, this Saturday we had a drug court surprise. We're working with probation. Since I've been sheriff, we work with them, and we pick a few days during the year on a Saturday where we invite people in and they're tested. And this weekend I think it was about 15 people who violated from drug court who got surprise tested on Saturday. But I take that opportunity to talk to them. And in our county, I say it's a lot higher. I say it's over 65% of the people that I see in drug court and I talk to and communicate with started with prescription pills, and a lot of them started with an injury and a doctor's prescription. Now in New Jersey, prosecutor, correct me if I'm wrong, we passed a law that said 5 days of prescriptions, correct?
Yeah.
And we're one of the toughest, but the CDC recommends 3 days. Anything over 3 days, their recommendation is 3 days. In New Jersey, we're better than most in that we have 5. I think New York, Connecticut, they're like 7, and others are just unlimited. And the doctors really, with all due respect, the doctors have really caused a lot of what I see pain in our community.
Yeah, just for pills, we started having a prescription drop-off in Ocean County in 2014, and so far we've collected 23,000 pounds of pills. So that's, that's 11 tons of pills have been brought in. I think you have to understand that is, an incredible amount of pills that are out there. And again, we're going to continue to drill down not only in the local communities, but certainly in the senior citizen villages, so that they don't get into untoward hands.
One final question for the two of you. You can each take a turn in answering. What policy or law needs to be expanded on, or a new one that needs to be enacted to finish cleaning the drugs off the streets, keep the drug dealers at bay, and ultimately find help for those suffering with this disease?
Well, that's a pretty tough question. Again, I don't think you're going to, lock yourself out or incarcerate your way out of this problem. Look, the problem is complex. It's multidimensional from the very beginning. You have to take a look at it. If we were just dealing with heroin alone, okay, it'd been one thing, but with the advent of synthetic opioids that have come in and the lightness and how easy they're produced, okay, the laws that we have are somewhat antiquated in the sense that the way that we judge how severe the penalty is going to be is by the weight. But that's changed. When I first became a Deputy Attorney General back in the early 70s, we used to do it by weight. And heroin was 23% pure. Heroin today is 82% pure. Okay, so you need less of it to be potent. And heroin is not even the problem as much as the synthetic opioids. You take fentanyl. The reason why fentanyl is so powerful is because it's given to cancer patients to extend them longer. It gets buried into the muscles and into the bones. It's a drug that just a small grain will kill somebody. And that's the reason why we're doubling every year. That's why I think this year we're probably going to have 300 deaths, only because each of these packets have a little fentanyl in it. And our laws can't catch up to the changing of the situation. The situation is changing so rapidly, almost on a weekly, monthly basis, that the legislature can't react quick enough to catch up to what we need to do to address the problem.
Sheriff, did you have anything to add?
No, just that, until you cut demand, it's like anything else. We have to cut the demand. Now, does it start with education? But yes, but we're having people will have to realize that it's not just high school. You can't do DARE or LEAD or GRADE or whatever program you want. That's good, and that's a step. This past weekend with drug court, the average age was probably about 32 years of age. 32. So they're beyond their teen years, and we asked them, I specifically asked them, what do you think the answer is? And they say, until you cut the demand. And again, a lot of the ones we had, they got hooked on the pills first. you know, and took it from that standpoint. This is live radio, but I'm just getting updates from the warden, deputy warden, on our individual I'm concerned about right now. He has 2 bails, 203 on. He claims his girlfriend wired money from California, which he has a drug problem, and hopes to get him out tonight. Mental health just cleared him. If he bails out, we have to let him go. No calls reference to bail except for his mom calling about her concerns. So here's another one in Ocean County, real time. It's happening right now, man. It's a shame. It hurts.
Thank you, Sheriff and Prosecutor. We're now going to take 2 minutes for questions from the audience. If you, in the back, come on. You too. You can come on up. Follow. Then you first.
Prosecutor Coronado?
Hey, is it Nick?
Yes, sir, it is.
Hey,
How you doing, all right?
yes.
Joe and I have been friends for a very long time. I was in the state police as a narcotics detective. When Joe was, can you hear me all right?
A little bit. Grab the mic.
If I could just interrupt real quick, if you could just get to the question.
How's that better?
Better.
Okay. Yeah, I was a narcotics detective in the state police for 25 years. During that time, I worked very closely with Joe when he was with the Division of Criminal Justice. And I can say that any time, day or night, that I needed a warrant, a body mic, or something, all I had to do was pick up that phone, and he would be there. And here we are, over 30 years later, and Joe is still here. He's still hammering away at it, as I am now as a person who's retired. What I want to talk about real quickly is this fentanyl. I think within the last week, there was a seizure between 25 and 30 pounds of fentanyl.
22 pounds.
11 kilos, okay, correct.
10
Okay,
kilos.
corrected. 22 pounds of fentanyl. And when you think about that amount, and where it came from, what they're using it for, I can tell you they're selling it on the streets as heroin. Not only in powdered form, but in pill form. So when our people are out on the block buying what they think is a prescription drug, in reality, it isn't. It's a drug that's being pressed from fentanyl and other opiates and selling them out on the street. And I've been keeping track, as Joe has, on the amount of deaths that's gone on in Ocean County for the past 5 years. And that's what brings me out to all these things now, because I'm hoping there's something I can do out there to help Joe and the police departments end this scourge that we're faced with today. So thank you again, Joe. You're doing a great job.
Thank you. And I hate to cut everybody else off. We've got to move on to the next panelist that we're running out of time. I want to welcome in the panel Steve Willis from Hope Sheds Light. Quickly, I know your agency not only offers education but also guides families to the most appropriate treatment for their needs. How do you determine what types of treatment are most effective for every individual that comes in from case to case?
Good, thank you. The Hope Sheds Light is about 3.5 years old. It's the original idea of Ron Rossetto, who's a co-founder, and Argo Creamer, along with me as the other founder. Ron's original idea came after he lost his son, Mark. We started Hope Sheds Light about 1 month before I lost my son, also named Mark. The fundamental thing we started with was the idea that we as parents who struggled with our son's addiction, it became our addiction, because addiction is a family disease, you know that.
Yep.
It affects everybody. So Ron's original idea was, Steve, or question, did you have any idea what you were doing those 20 years ago when things started with your son? And really asking, did you know what resources were out there? Did you know where to turn, what to do? And I said no. He said, let's create a website. So that's what we did first with the help of the community. We developed a website that lists inpatients, outpatients, supports groups, grief counselors, individual counselors, And we are revising that list based on the response we're getting from the programs when we're able to refer wonderful people to them. Okay? The website talks about the disease of addiction, chronic, aggressive, and fatal if left untreated. And again, importantly, so important to us, it talks about the family component. Codependency is huge. Right? So we list various behaviors with different drugs, and we have a helpline. The helpline can be called by anybody, and it's called by parents normally, asking where can we put our loved one? And we're able to meet with people. And I'll get to the question in just a second, but we're able to meet with people and we ask why are you using? Okay, we're not a treatment facility, but we've got a great deal of experience of being able to ask the right questions. Why are you using, young man? Because it's not just about saying, well, if it's heroin, we're going to help you get into by making phone calls and calling people we know, just get into a substance abuse program. What if there's anxiety and depression? What if there's bipolar or anger or resentment or trauma? Many times, in my experience in these 20 years doing this, that's what gives rise to addiction. Right? It's a self-medication of things that go unresolved. Those secrets are keeping people sick. So when families come to us and we try to give them the right treatment, we ask those questions. What's going on with your loved one that's so sick, but what's also going on among you? Is there a genetic predisposition to use? Tell us, right? When I lecture to doctors and nurses, I'm asking them to do that proper assessment too. We have to find out why. What we're blessed to be able to do, though, with the help of Anthony, with the help of a bunch of other wonderful programs out there, through these years we can call them and say, well, we think, and we know it's a co-occurring issue here, formerly dual diagnosis, right? So maybe it's not just a substance abuse program. Maybe we need preferred behavioral health. Maybe we need OSHA mental health. Maybe we need the individual therapist because some of them are just not good with group therapy. Those are the things that we're asking, and we are able to move individuals with the help of these wonderful programs into treatment. And the blessing for us is that Hope Sheds Life focuses on families. We have a family support group, which was, our next one is March 28th, by the way. Starting April, we're going to have it the second and fourth Tuesday of every month. And the wonderful part about that is that it's nothing but love and hope and strength and experience. We have an interesting group of people that come. We have parents who have no idea what they're doing. We have young people who are still using that come, some of them, but they're there with us. We have folks who have 25, 40 years clean. We have young people that have that clean time. So we have a speaker that comes in that talks about addiction, recovery, prevention, whatever aspect for about 35, 45 minutes. And then my favorite part is that we break out into groups and we share. What's on your heart? Why are you here? Let us give you the strength and the hope that you need to move forward. So we provide an educated plan that's based on love and is based on a whole bunch of experience to move individuals and these wonderful families into the kind of help that they need.
When someone suffering through the disease of addiction first comes to you, what are some of their emotions going through? Is it bravery? Is it frustration? Is it trying to move on to the next part of their life and trying to find some healing?
You know, it's interesting. The blessing for me is that some people come who really want to get help. Most of the time, in my experience, though, it's families that are coming to us and saying, Steve, our kid won't stop using, and we don't know what to do. And we can tell them with the help of not just me, but a whole bunch of people that are in recovery along with me. You, family members, have to learn how to love in the right way. You have to get strong in order to create an environment for your loved one, when and if they get ready to get well, to get strong. Does that make sense? That's what we're able to teach. That's what we're able to share. The folks that come, though, and we can help families create circumstances, by the way, that will give their loved one the best shot of recovery. Okay? And that's something we can talk about afterwards if you like to. Or just join our meeting, right? Come with us. Become a part of Hope and we'll show you. Okay? But when the individual comes and they finally say, you know, Steve, well, I'm all banged up, I don't know what I'm doing, it does take courage to do that. Okay? And we talk about courage and bravery all the time. especially the courage to address what ails you, right? I have a young woman that I've helped to get into 5 residential programs. The mental health is really driving this thing. She was raped early on, a lot. That's a lot of pain to deal with, and she never has. So she's been to several, substance abuse programs, and they don't work. Some people think the program doesn't work. She hasn't addressed what's most important. Last night, I got her out of jail as her, counsel to go to, preferred and also to deal with the trauma. I got a report that she stuck a needle with heroin into her jugular because apparently she wants to die, but she doesn't seem to be very good at it. So I'm going to talk to her about that too. Courage to start, but really it takes courage to deal again with what ails us. And this recovery thing for individuals and for families does not happen alone. In my experience, those people that are trying to recover alone will fail. We recover. I recover. Only because I was humble enough to look around and say, I don't know what I'm doing. Everything that I'm doing isn't working. I need the help of people who know more than I do. And when I got to that point where I finally started to listen instead of talking, I learned. I was able to implement those ideas into my behavior. Right? I know for a fact that anybody can recover. And I say that even though my son's dead. The reason he's dead is because he kept saying, I got this, Dad, I can do this myself. And it always broke my heart. So when those folks come to us, whether it's Anthony's program, the HEART program, when they're ready, miracles happen. We, as family members, and we as a community have to learn enough to help them get ready. I hope that answers the question.
It does. Thank you. Let's open it up for a minute or two of questions for Steve Willis. Please come on down to the mic.
See you every day before I left the courthouse.
Yes, sir.
Hi, John. My question just goes back before, like, the drugs that are given out by the doctors. We can't control that. Why can't we control that? Because it does start with an accident. It does start with.
Well, I can tell you what
And
OSHA,
it's even worse.
I can tell you what OSHA's light has done. We've gone into the hospitals and we've shared a compelling story of losing a child. And we wanted to get their attention. And I've just tried to, personally, went through my organization, we just tried to educate them. The change in behavior comes with education. When the pain management doctor stood up and said, Steve, you don't know this. I said, what do I not know? He said, well, like, where are the doctors? This was some time ago. I said, okay. I said, when I donated a kidney, which was the second best thing I ever did besides, marrying my wife, that was some years ago. The doctor 4 years ago gave me 90 Vicodin, 90. And I've explained these to the doctors, and I told them I only needed 2 because I was a sissy the first day. Okay? I just challenged them. I said, when I come in as a patient to the hospital, doctors, why is it that your standard of success, or whatever the proper thing is, why is it like 0? When they ask you, what's your pain threshold? 0 to 10 or something? I said, why isn't it 4 or 5? And they looked at me like I was crazy. I simply said, pain teaches. Yes. Best lessons I ever learned were somewhat painful. This is why Joe and I can agree to disagree a little bit on jail. I know that short-term jail works for 2 reasons. It can stop destructive behavior, and it also makes a person reflect on what's going on. And with God's grace, they don't like it, right? So when doctors are learning more, and by the way, I think they are learning more, there's a prescription monitoring program that's out there now, and I believe the pain management doctors are required to look at that, which is a database. So they can know exactly what my clients, who I defend as a criminal defense attorney, are doing, right? When they're doctor shopping, the doctors can look at these things and then call the authorities and say, that's not a good thing.
I was just saying, as law enforcement, like, we're so strong in law enforcement, why can't we force them to not?
Well, actually, the prosecutor has staff, and I have staff at the sheriff's office assigned to DEA that do monitor doctors and are aggressively going after them at this time.
The problem is a little bit more complex. The healthcare community for years, okay, health grades always said to patients and like that, has your pain has been adequately handled? Do you continue to have pain? And they have for years pushed pain medicine. So does the pharmaceutical companies. So for now the change, and there's certainly to be an abrupt changes coming in, because if you look at the pharmaceutical companies over the years, for the last 15 or 20 years, they have pushed out so many pills that no wonder why we are where we are here today. And now we get, it's clear you're right. And even the hospitals, they were graded out based on the fact as whether their pain was adequately addressed while they were in the hospital, and does it continue to be adequately addressed. That needs to be changed. The healthcare community itself needs to look upon itself and look at how to handle pain management. And I think with the advent of what's happening with all these deaths, I think they're starting to get the message.
So I read a great one
Quick
about marijuana being legalized. I don't know, that would be great. But anyway, where are the detox centers? Where are the rehabs? I've recently had a gentleman reach out to me, and it was through a text message. He knew that I was familiar with people who had done heroin. My ex was locked up for dealing it. Like, he just came to me and he's like, I need a place to go to detox, or I'm just going to shoot as much heroin as I can up my veins to die. Like, it was a suicide mission. And I remember I got so frustrated because I called the 800 numbers and I called places and they were like, oh, it doesn't have health insurance. Here, call this. So if that really was a real addict, I couldn't even
Tomorrow,
imagine.
Manchester.
What was that?
Manchester. Go to Manchester, 9 o'clock tomorrow morning, okay? Just tell them to go to Manchester tomorrow morning at 9
Oh,
o'clock.
no. He's gone. He went to Florida. He got help. Thank God, yeah, it's
Well,
awesome. But my question is I feel like that's scary to so many people. Like, they don't want to detox from the pills, from heroin, anything. And we don't have any detox centers, and I know that jail works. Yes, lock them up for a couple weeks, get them clean, get them thinking right. But where is that in our community? And
Well,
why
there is a detox right here in Toms River, which is
not
sunrise.
with not enough beds?
Well, I'm just telling you, there is a detox here. We send them up to Bergen Pines, and that's one of the reasons why, if you come on a Wednesday, okay, to Manchester, Integrity then takes those people that come in here, and they find the detox beds for them. And if it's on a Thursday, you go to Integrity, and they find a detox bed for you. Bottom line is, we're trying to make it easier for you. Because now you call up on the phone, you wait 17 minutes to find somebody to get there, and then they send you someplace. Well, all you have to do, okay, you know, we're going to have 50 people there tomorrow, but it's okay. Go to Manchester or go to Brick, okay, and they'll handle it.
Okay, so they'll set these people up now that you guys have that resource.
But just to respond to your point, there are limited resources in New Jersey. That's the problem that we're dealing with. You know, I think we all know it.
And what do you suggest the community can do? I mean, I would love to get involved, and I know that there are certain things, but the parents, I mean, the false sense of security from Narcan, I know people were like, yeah, well, I'm just going to get saved, you know what I mean? And they can start over again. So I love seeing the progress. I just really would love to see or get more information out to our community saying, this is what you can do to help. Because I see him, everyone sees him at Wawa. You know what I mean? Like, that's where the meeting spot is. I've seen heroin deals happen in the bathroom and 2 police sitting by the coffee shop.
I think it's a question about education.
It's frustrating. Okay, I'm sorry.
I had the pleasure of speaking with Senator Vitale not too long ago. We sponsored a lot of different bills. Okay? And I asked kind of the same question. I said, Senator, we don't have enough detoxes. We don't have enough residential programs. And I said, before you mention, I said, you're probably going to tell me that we just don't have enough money to do it. And his response back to me was interesting. He said to me, Steve, he said, it's not that this state doesn't have enough money. It's just that everybody's got their hand out. I think we need to reprioritize. And that comes with education. And that comes when every segment of the community, the businesses, the medical community, law enforcement, our schools, the medical community understands that our kids are dying. Right? And that recovery is not just possible, It's absolutely real when the right resources are there.
I'd like to move things along over to Anthony here, who I know has already spoken. He's with Preferred Behavioral Health. In your experience, at what point do some of these people going through addiction, like drug abusers, determine that they must stop? Are there any warning signs that are going through them mentally saying, okay, I got to stop what I'm doing now?
I mean, it's usually a major crisis that happens. And it's interesting because I have to reflect on the HEART program a little, because we've been doing it for about a month and a half. And most of the people that come into the HEART are beaten down. They come with suitcases. They come ready to go into treatment. We're not fighting to say, well, you got to go in treatment. They want it, and they want it right then. And the only problem is we don't have it right then. That's why we use recovery specialists like John and his team of recovery specialists. We'll do anything we can, but it's usually a crisis that brings somebody into treatment. It's not like they wake up one morning and say, okay, I have enough, I'm done. We know it. They get locked up. As Ed, one of my colleagues, would say, live as lawyers or lovers. Something happens bad, and they come in, and they have to hit a bottom, and then we have to help them. We're trying to make it so maybe the bottom doesn't have to be that low, and they don't have to get knocked 4 or 5 times before they reach out for help. Because even though you would think after somebody wakes up from an overdose, they're ready to give up the drugs, they're not. They're ready to go get another bag of dope so they don't feel the pain and the reality. And Steve is 100% right when he talks about underlying issues, mental health issues, crisis. I mean, some of the cases that we see at Preferred deal with both co-occurring, issues. So we deal with people that have mental health issues, suicide attempts, and also have drug problems. And it's a very big part of the issue, is that, unlike a mental health person that goes into a hospital to the psychiatric emergency screening, where they get held for 3 days, let an addict show up at the hospital, and you know what they're going to say? See ya. We can't keep you because your problem is drugs. When we all know underneath that problem is a mental health issue or a crisis or something that happened. Steve talked about that woman who had underlying issues when she was a child. I mean, it goes back, and if you don't deal with the problem that's underneath the drug problem, it's very hard to get somebody into sobriety or to get them clean, help them get clean.
What about when your patients are parents? What are some of the things that you're telling the children of the parents who are abusing drugs?
I mean, in terms of, so we counsel on both sides, right? We have a brand new children's center in Brick that's doing a great job of counseling children of addicts. And then we also counsel the addicts. And one of the things that I will say, and everybody may have a different take on this, I've been at Preferred for 20 years, and I've been in Ocean County for about 24 years, working with the addiction population. And I usually say, let somebody get set up first in their recovery before they start dealing with, family issues and children issues. Get a little time, because the last thing you want to do is tell a child that you have a drug problem and then go back out again and use. You're gonna, it just does a lot more damage than you would think. And for children that we counsel, we use, whatever tactics seem the most adaptable to the child. Like if somebody's going to be going away to treatment, we say, Mommy and Daddy, you're going to go get help. We try to soften the blow for the children. And not an easy thing to do, but we have many professional people, family therapists. We have the whole gamut of professionals that Preferred. And I'm not pushing the services because there's plenty of good agencies, but I just know the work that we do at Preferred, especially the last intervention that we started with the prosecutor and the HEART, has been amazing. For the staff, for us, for the clients, because I just drove a client to Turning Point last week on a Friday, and I said I was from the HEART program. They gave me a tour of the facility. They said, we'll do anything for anybody that comes from the HEART program. So it is making a dent. And I remember when the prosecutor had it as his, he talked about a lot of things, and I was at that meeting, and I said, I hope he doesn't ask me to do this. And, you know, before I left, he said, hey, Anthony, I got a question for you. And that was it. I was in 100%. And our CEO, Mary Pat Angelini, supports the work we're doing with the prosecutor big time. I mean, we want Ocean County to get back on track, the whole community. If you think about it, we're number one in overdoses, maybe we're number two. How could that be with such a beautiful community and so many good families and good people? It's hard to understand it, but everybody up here is doing their best to fight it. I can say that. Steve, Sheriff Mastinati, John Brogan, and we all know Prosecutor Coronato's our leader. You know, he's doing the job.
I want to move along for final panelists, and we'll try to get to a couple questions at the end. I want to introduce John Brogan. John, your Narcan rescue is the cautionary tale for a growing number of users turning over to treatment. What was your point of entry to opiate abuse, and how did you end up pulling through it? Because after you hit rock bottom.
Thanks for having me here. This is quite an honor to be in my hometown here, up here, with these panelists. You know, I went through opiates just like everyone else, those little blue Roxicet pills. You know, I was a drinker and a pothead when I came home from the Marine Corps, and that's all I wanted to do. I just wanted to drink, I just wanted to smoke pot. I had no idea that I was suffering from a condition that those substances treated. And I think as we're talking here today, like, and I'm listening and I'm listening and I'm listening, you know, what are we teaching and what are we learning? You know, the drugs and the alcohol are not the problem. They actually treat the problem. The problem is the selfishness, self-centeredness that I suffer from. So those Roxicets turned my world upside down, those opiate pills. And I never looked back. It took the feeling of marijuana and alcohol and everything else you could combine all into one, licking paint chips, whatever it was, to make me not feel the way I felt. And there's no reason for that. You know, I can blame it on this or blame it on that, and it just is. And once I found that magic combination of the opiate, it was done. And then once that ran out, and I was sick and couldn't do it anymore and couldn't afford it, it was right on Brooks Road in Toms River. That's where I was living. I'll never forget it. I took that drive out to Philadelphia for the first time and never looked back. And in a very few short years, my family was gone. I had overdosed 4 times until I just tried to take my own life by hanging myself. Alone in an apartment that wasn't even the worst part, was thinking about it for 2 weeks before. That was the suffering of addiction for me, when I didn't have the substances in me. So, and as we're sitting here and I'm thinking, you know, the gentleman that the sheriff was talking about, he's on his way to treatment thanks to our recovery specialist and the prosecutor. That's how quick these guys are showing up. I'm a recovery specialist, long-term too, 6 months. And the deal is this, you know, what are we teaching them? You know, if I could take a second, you know, Lamont A, can you stand up? Frederick M, can you stand up? Anthony M, can you stand up? These guys right here, these are the first 3 heart clients a couple months ago. Here they're standing here with a completely new way of life. Why is that? And hundreds more right down the pike. Why is that? Because they went internal. They went to a long-term place so that they could look at themselves inside, removed from a substance, not being given a pill to fix it. And now they're all back here looking to face down their legal charges, face down the things. If jail worked, I would have been saved a long time ago. It works as a short period of time, like someone said, as a detox. But if I could remember the pain and the shame from before, I wouldn't be an addict. It'd be a behavioral issue. Well, that was really bad. I'll never do it again. But I did it over and over and over again. There's a little line in our literature that says, "Fraught the emotional appeal will not suffice." That means my mom crying, my daughter's crying, my wife, everyone crying. And they're saying to me, "John, why can't you just stop? For the love of God, why can't you stop?" And on some deep level, I don't even know where I was pulling from. I'm saying I want to stop and I can't. And any family member that's out here that's dealt with an addict, they know the look and they know what that looks like. And that's why we're suffering these deaths, because there's no peer-to-peer. You know, and that's where the prosecutor was the first person to sit down and listen to someone in recovery.
long-term, abstinence-based, 12-step recovery. And now you have the results that you're seeing here pop up in Ocean County and Monmouth County.
What would you feel about following an arrest, going instead of right to jail to a long-term recovery group for somebody who's a repeated user? Do you think that would have helped you by going directly to a long-term recovery group?
Absolutely. You know, long-term, and what does the treatment look like? That's the question we're not asking. What does that treatment look like? What are they doing at these treatment centers? Most of them, they're just, if the drugs and alcohol treat what's wrong with them, and they've removed that treatment, and they just stick them in a place, the problem gets worse, not better. That's where the program of recovery, that's where these long-term places, they focus on that, and they replace that drug with hope, with love, with a different way of life. So that these people can come back, face what they've done wrong in their addiction, and start helping others.
Now, you and I had spoken previously to the event about education a little bit. How early, and if any of the other panelists want to jump in, feel free, how early is too early to start educating today's youth on the dangers of drugs? Middle school, high school, I mean, the drug education is already there. Would elementary school students, would that be a benefit to teach them more about the dangers of drugs?
Prevention is absolutely necessary. However, the prevention that we've had clearly didn't, you know, there's some kinks in the armor there. So we have to look at it. Rutgers is doing a great job right now with a few books. The prosecutor's office with Manchester Police Department, they're looking at, you know, the middle school age and younger. You know, we talk about it all the time, 10, 9, 8. How do you talk to them about drugs? Well, Rutgers came up with a raccoon book, kind of disguised it going in. So we got to get creative, but you got to look at the prevention because the kids are doing it at 10, 11, 12 years old right now.
Yeah, I think, you know, let me just jump in here. I do think that, you know, first, second, and third grade to a certain extent that needs some sort of education, but it doesn't have to be hard education. But certainly when you get to middle school, that's when you really need, from my standpoint, attack. And I think you need to go strong in middle school, and then I think you need to go right straight through high school. And I don't think that you need to just do it once or twice a year. I think it should be in the curriculum. I think it should be buried in there. I think it's something that needs to be repetitive over and over and over again. And let me just I don't mean to get on the bandstand here, but, you know, when we first have children, that's the most important to me in my life is my family. You know, and somebody is sick, we always tell our kid, look, let's take you to the doctor because they're going to give you a pill to make you feel better. And then after a while, the kids learn that, you know, they can go and they can get a pill from the doctor when I have a cold, they can give me a pill when I have this problem, and before you know it, their mindset is, give me a pill because it's going to solve my problem. That in itself is a problem, okay? And then what happens is we then say, wait a minute, you know, it says, like, I can take 2 Tylenol, but I know that I can take 3. Or it says that I can take 2 Tylenol, I can take it after 4 hours, but I know after 3 hours I can take it. And we then learn to do, and we teach our kids to self-medicate, okay? So there is a process here that needs to change, and our mentality needs to change. And that really makes a difference. And then the other thing is that the family life is not the same way. You know, kids and people are just moving out in different directions. What I mean by that is the dad's taking John to soccer, mom's taking Mary to cheerleading. They don't eat at the family table all at the same time. If they're already eating at the table at the same time, they got their cell phones on. They're not paying attention to the conversation that's going on. Family life has changed, and as a result, the kids spend more time with their friends, up in bedrooms, down in basements, out in the garage, in the backyard. And what happens after a while, there isn't that connect. You don't hear what the child is doing anymore. You lose that connect. It's all, and that itself is not going to solve the problem, but it's part of the problem.
John, I wanted to go back to kind of what you went through before you hit the bottom. Were there any warning signs mentally? Were there any thoughts that came in your head and says, okay, I got to stop? And what would your advice be to anybody else who's suffering with the disease of addiction to get help?
Yeah, I mean, I was always thinking I was such a great guy. I didn't understand why no one wanted to be around me. You know, it's the disease of addiction. You know, I walk in the room, and you're the biggest piece of you know what I ever met, but I feel a little bit less than you. That's how I feel. But when I take that magic potion, you know, I'm bigger, I'm stronger, I can dance, I can do all the things, that magic elixir of life, they say. You know, and then that doesn't stop the consequence. That's why it worked. the mixture worked in the beginning. That's why I did it, but then it doesn't work after a certain point.
All right, we have a couple minutes left for a couple of questions. I know you've been waiting for a while. Go ahead.
Don't mind me, I'm a little shaky on my feet. As I fell in the
Don't worry,
hospital.
don't worry.
And I prayed to God that I'd get out of the hospital to be here.
Talk in the mic.
Oh, I'm sorry. I just want to let everybody know that it's been 51 years and 48 years that I've had many, many troubles. It started when I came here in 1965 from England. I was taken for a couple of years away from my family, and I didn't have a choice for drugs. I was just beaten, drugged daily. And I do have great faith. My parents, I remember my prayers, they couldn't take that away from me. But on a daily basis, it was a non-stop force-feeding drugs. And I carried that shame when I was only 11 years old. When I came to this country, I was 9. And I had no bearings. I moved to Belleville, New Jersey. My father bought a Victorian home. And there was no programs, no anything. And my father, he would try to look for me and whatever. They didn't find me. I found my way back. But I was never the same. It took many, many years of my family going through the torment, because you weren't supposed to talk about anything back then. But the torment and the love that they supported me, and they even kept the tree up for 2 years, thinking I would come home, and I did, eventually. But, you know, I'm in my 60s now, and it's still vividly in my mind every day. I conquered, taking drugs and everything else. It took a while. I had many roads and hurdles to go through. And by the grace of God and prayer, I chose, to stop. That's because I got married young. My husband was older than me. He was in Vietnam. And I had a son. I was 18 and I had my first child. And that, right there, God gave me something more than what happened to me. And I can honestly say, I never spoke about it to them. I have a 42-year-old, a 41, and a 33-year-old. And I knew it was their formative years, even though I was young in my own mind.
Ma'am, if I could interrupt, I just need you to get to the question.
Okay, I just want to let you know that I still go through the process of everything, and preferred behavioral health, I vouch for. It took me up until a year ago to even. I got introduced to them, and I started going, just so I could start talking about things, because I held on to it for so many years. And because of preferred behavioral health, I mean, I am who I am today. I mean, I'm not, the best. I didn't meet what I wanted to meet in my life, what I wanted to do. I did a lot of things, great things, and I thank God for that. But I went to them last year, and I'm still continuing going and talking about it, because I needed to let it go after 50-something years, because I held on to it, and
Excuse me, ma'am. I hate to be that guy, but this is very important. We've listened to you for quite a while. We have some questions we'd like to
Excuse me,
ask.
sir.
I'm sorry, but I just want to let you know, I preferred behavioral health, I'm still going there, and I still go. Great, thank you.
I just stopped us where it is, but we got to wrap up. We're out of time for tonight. I'd like to close tonight's town hall event with a couple of just brief closing remarks. Many thanks to our partners, Preferred Behavioral Health and Ocean County College, and Dan Kirsten for providing the venue for tonight's dialogue. Thank you to our panelists tonight for providing their expertise. And thank you as well to my colleagues with Townsquare Media New Jersey Shore Division. The journey towards the solution won't be easy. It will take patience, hope, time, action, and prayer. Please take the stories and the testimony you heard from our panelists tonight and take it with you as you go and spread their message. I'm Vin Ebenu, saying good night from the Grunin Center at Ocean County College.
Are we up there? That's fine. I can swear now. John, you struck a chord with me when you said you tried to hang yourself. Obviously, you were an addict, but yeah, you tried to hang yourself. You didn't try to overdose. My son was an addict, and he committed suicide by train. I think there's some information as we start to peel back how much opiates can be prescribed. Right? How are we going to measure the success and the results of that? And going to the point of education, I'm on the Lacey Task Force, and recently, I've proposed to them start teaching these kids early, getting the message out, and tailoring the message, for kindergartners to third graders, so you don't scare the heck out of them. But then when you get to 4th, 5th, 6th, 7th, and 8th graders, the messaging has to become more tailored to their problems. And I want to just cite a personal experience. My wife was a speech pathologist in Barnegat. She's on the child study team. So she's doing K through 6, right? And so all these kids present behavior. They present the behavior early on. And all the teachers see it. They talk about it in the teacher's room. They said, Johnny did this, Johnny acted out. He did that last year in my class. And so there's a root cause, you're right. Underneath all this, like Mr. Wills said, the girl had a root cause issue. And so if we can deal with the root cause issue early on, maybe we can prevent, because this is really, it's new use, overdose, and death. That's what you're dealing with. But unfortunately, what I don't see enough of is attention to new use. And I don't see that being measured and that being understood. And I'd like to ask you what you can do to stop new use, especially from an educational standpoint in lower grades, without upsetting parents. Because nobody wants their little kid to come home and say, Mommy, Daddy, guess what they told me at school today? Yeah, does anybody have any ideas on how you could possibly move that conversation forward?
Well, I congratulate for all that you do down in Lacey Township. You do a tremendous job, you really do. And I do agree with you. I meet every month with the superintendent of schools, okay? I have a great relationship with them. I think that we're trying to change the curriculum in the schools, okay, so that it's embedded in the schools and continuate. I think that that's what I want to use my forfeiture money for, is to help them with the curriculum and to make the curriculum appropriately adaptable. But I will tell you this, if you think that this problem is going to go away with money in a year or 2 years or 3 years, you're wrong. This is a huge, huge problem that's going to continue on for years. I make it akin to the tobacco problem, the kids smoking in school, and it took 20 or 30 years before they really got down to really address it. And they also had to hold the tobacco industry somewhat accountable for what was going on. We need to do the same thing with the pharmaceutical companies. So when I say that this is multi-layered, multi-development as you go through, again, it's not going to be law enforcement, but now they've invited me to the table, okay? We're going to address some of these issues, and we're going to make sure in the long term that we can solve the problem. But again, the money ought to be spent not in law enforcement, okay? It needs to be spent more on prevention and more on health care in the back end.
So if you're living in an African bush family, right, and you're barely surviving and you've got little kids, what does the father tell his child? Don't pet the mambo. You know what I mean? That snake will kill you. We're not telling our children that snake will kill you early enough on.
That goes back to what I said about the family unit and about the people
Exactly.
running.
The disconnection, the family table.
And that's part of the problem. That's part of the problem. So I'm saying all all the problems.
Thank you very much. I'll sit down now.
Good evening, esteemed panel. Ever since the 80s and Nancy Reagan said, why don't you just say no LT, and we declared a war on drugs, finally 50 years later we're realizing that we can't arrest our way to victory. And I'm sure some of our panel knows me personally. I'm a recovering addict, having over 5 years clean at this time.
He's also a recovery specialist.
That's it. Having got involved in this program via a message on Facebook to the prosecutor spokesperson, I had mentioned to him, and I think now the time might be ideal for this to maybe discuss, because we have the right people in front of us, and with what's going on with bail reform, there's a lot more jail space. In the mid-90s, I was in Bergen County Jail, and they had a drug program within the jail. And that's what happened. I made that suggestion to the prosecutor's spokesperson. And you could give the people the option, either if you really want help, you have help at the county, and you have space there. I mean, what would it really take to get maybe some counselors or you have a medical wing to get that started? You know, Sheriff Mastinardi mentioned somebody was in jail. He wanted to keep the person in jail to save their life, not just to get out, just to keep them alive. I mean, that's an initiative that maybe with the two people here that we can look at.
Well, let me just start with this. Mike may have different numbers, but it doesn't look like our jail population has really reduced all that much right now. Now, do I agree with you? Eventually, is the jail population going to come down? The answer is, I think it will, okay? And somebody mentioned before, it's probably one of the best detox facilities that we've had in the county. But under bail reform, hardly anybody's going to go to jail right off the bat, okay? They're going to be let out. So you're right, there's going to be room in the jail. But I will tell you this, and I'm a practical person, but you're going to be able to tell a 19-year-old or a 21-year-old, look, I need help, but by the way, I want to put you in the county jail. I mean, I don't think that's really going to sell very well. I have to be honest with you. Do I think, and part of the problem really is this, people have to want. In other words, they need to want to help. The young lady that came up before really hit the nail on the head. There's not enough beds. There's not enough facilities out there. And my point is that the only people right now that we can take care of are the people who want to be taken care of, the people who really want it. So if you have a drug problem and you think you can handle it yourself and you don't want to come in, I'm not in a position where I'm going to force it on you. Because you know what? I don't have enough beds. I don't have enough facilities to be able to do it. And if we could, God willing, take some of that space that's in the jail and make it into some sort of rehab or detox facility, I'm all for it. I just don't think right now it's there.
Let me just say this. In the 90s, what they did, they gave you, in a program in the jail, a little nicer place. You know what I mean? Carpet on the floors, whatever it was, maybe an extra meal, maybe whatever, some incentive. But I went into it. I was that type of guy that, like, I wanted to convince myself that I was done. I was just coming out of ADSEG in the county and said, you know what, I really need to do something about this. And it wasn't my first experience with treatment, because I did treatment in the 80s in the state prison system. You know, I never gave up, but when there was an opportunity like that, I took it. Well, the point is that there are going to be empty beds. There may be some space. It may not cost that much to do it. These are people that, if they want to take it, and like you said earlier, that some people are so beaten they turn themselves into the police station. What would we say? Listen, you go over to county, whatever. We have treatment. We have counselors. A little bit nicer. I'm just saying a possibility of opening that door and talking about it, and maybe coming up with something that could work.
It's a good idea, and we've talked about it. To be honest, we have talked about it.
Yeah, and the sheriff's office doesn't have the jail. It's a separate warden under the freeholders.
I do understand that.
Okay.
Thank you.
But we support you.
Anybody who's online now, perhaps if you didn't, anybody else who's online,
He said that we have to be out of here by 8:30, so we'll meet you in the parking lot. Next, Paul.
How you doing, Sheriff? Prosecutor Coronado, Steve, Anthony, John. I have a gnawing question. I have several gnawing questions, but I'll try to settle for one. And I'll briefly preface it by saying this much. Primarily, I am concerned with the quality of services, treatment services that men and women who are suffering with addiction are going to get. All these things can sound good and look good. My concern, though, is look behind the curtain and see what's really going on, because I want to know that this is actually going to work. The HEART program is new. Frankly, I can't give it any great accolades yet because it's too new. But it's certainly, I'll even concede that it is a step in the right direction, possibly. But in that regard, the question is this. Your spokesman, Mr. Coronado, Al Delfave, has said that in response to someone's question about there's nobody at Brick and there's nobody at Manchester on those particular days for the HEART program. And his response was generally that there is nobody on staff on site there until someone presents themselves. And I have no argument with that. But what he says is the treatment specialists, perhaps referencing recovery specialists, the treatment specialists are stationed at Preferred, Integrity, and Malvern, and only respond after the Addiction Triage Center is contacted when an applicant appears. My question is that in reference to the New Jersey Addiction Triage Center? Now, what role, if any, does the New Jersey Addiction Triage Center or Brogan Recovery play in the HEART program, if any?
Okay, this is how it works right now. And Anthony, you can correct me because we have two treatment facilities that we work with. On Wednesday, when you go to Manchester, you're brought to Integrity. Okay, and when you go to Integrity, the police department brings you to Integrity. And when you go to Integrity, there's a clinician right then and there who then comes in, speaks at an individual, and makes a proper designation as to how that person ought to be treated. On Thursday, if you go to Brick, the Brick Police bring you to Integrity, which is also located in Brick. There's a clinician on staff there. The reason why we're trying to limit it on Wednesdays and Thursdays is because that's when we have the clinicians that are there to kind of take a look at it. And I can't really have a recovery specialist make a clinical analysis of an individual. I want somebody from a treatment facility who has the proper credentials to go in and to take a look and make the clinical analysis of that individual. Now, to help the clinical people and to help Integrity and to help Preferred, okay, there are recovery people, and John helps me with the recovery people. They may help with transportation, but they also, what they're going to do is partner up with that individual. And what that means is it's a mentoring program. That means that when Anthony decides that this person is not suitable for inpatient but needs medicated treatment, that John's people, then that recovery coach, will then follow up with that person and be a mentor as it goes all the way through. Somebody who goes inpatient for 30 days and then you release them, guess what? In my opinion, they're just going to be floundering for a while. They need that individual, that mentoring, and that's what the recovery coaches provide. They provide that bond. It's a human bond. It's not a piece of paper. Somebody from the treatment center is not calling you up and saying to Jerry, well, how do you do it today? Guess what? There's somebody who's partnered up, who's married with them. The bottom line is that that's what's going to make a difference. These people here that come out through the program, God willing, a year from now, a year and a half from now, they'll turn out to be recovery coaches. They've been at the bottom of their life, and they'll help them. And if we can do more and more of this, that's how we're going to dig our way out. And look, you're right, Paul. Okay, you're right in this respect. The health department doesn't have a good way of assessing whether Turning Point is good or whether Integrity is good or another place is good. All these treatment facilities are out there. There's no standard. To a certain extent, I, as a law enforcement official, says, well, what's your best practices here? What's your proof? But look, you got to crawl before you walk. You got to walk before you run. To get somebody into treatment right now, we need to get them into treatment. But then we need to drill down on treatment. We need to get better. We need to work on it, and we need not to recycle these people. The one thing about our program, our HEART program that we use right now, is accountability. I get a report every single week from Anthony and from Cindy, and they tell me where the person is and where they are in their treatment. I know after 1 week, I know after 2 weeks, I know after 4 weeks. If they fall off the wagon, somebody's got to tell me why they thought that they fell off the wagon. I want to know why they didn't complete the program. I want to know what their problem was, because that's the only way I'm going to find out what works and what doesn't work. And the two programs, the reason why we have the two programs
Integrity is inpatient, and preferred is outpatient. I now want to see which one works. I want to see which one has a better outcome. I want to see how it's all working. So there's a method to our madness, and guess what? I'm still learning, okay? I don't think I have all the answers, but I'm trying to put a program together, figure it out, and that's where we are.
And just briefly, but what role, if any, does New Jersey Addiction Triage Center and John Brogan Recoveries play in the HEART program? Do they get paid?
No.
What role do they play?
They do not get paid. Nobody gets paid in my program. Okay, I don't get paid, Anthony doesn't get paid, John doesn't get paid, there's no money that's exchanged hands. I'm the prosecutor, I can't accept money, we're not going to accept any money. Somebody comes into the HEART program, there's no payment whatsoever. Now I will tell you this, there's 90% had no money whatsoever. Maybe the clothes, and how many people come in with their suitcases?
Almost 90%.
They come in with their suitcases, ready to go, ready to be shipped out to wherever we're going to go. Other 10% may have insurance, some sort of insurance, okay? And they're sporadically, but the ones who determine that, where they're going to go, is going to be integrity, and it's going to be preferred. They're the ones, they're the gatekeepers.
All right, thank you very much.
Oh, you're welcome to come help us though, anytime. And offer a solution, anytime.
I think I heard that. Whenever you're ready, you can call me, buddy.
Or we follow you on the web.
I bet you do.
All the time.
I don't care how many times John blocks me. I know he follows me.
First of all, thank you for everything all of you are doing. I have a question, and I get a lot of calls working with the K-9 from families when they suspect their children or even adults might be using. What rights do parents have checking children's bedrooms? I get that question all the time.
I'll tell you this, I check my daughter's.
In the world and check it's their house.
I'll tell you again, if you're living in my house, okay, I'm paying the electric, I'm paying the phone bill, I'm paying everything else. I have the right to go in that house.
Absolutely.
It's under my roof, that's the way it is. Now look, I can't say how other parents are, but I'll even tell you with my kids. I pay their cell phone. I tell them when I call, you better answer. If you don't call, I'm turning off the phone, okay? And I pay for it. So they all know that I don't care who's calling, you get my call or my wife's call, you're answering that call. So the bottom line is that that's something, that's that family situation that we were talking about before as to you know where you're going. Now, once the dad or mom finds the pills, you know, or finds the marijuana or finds the drugs, then you know what? They should realize at that point in time that they have an issue, and then they're going to end up going either to Anthony or they're going to go to Hope, Sheds Light.
So that's why I want your contact information to give to parents. Because 70% of the homes that I go in where parents suspect, she finds.
Okay, thank you.
Thank you.
I want to thank everyone up on the panel, Prosecutor John. I know John a long time, I love you, man. I've been a heroin addict for 25 years in Ocean County. I've been in the county jail several times. The last time I was in the county, I was there on like a minor, low-grade crime, but I wanted help for my addiction. So I asked for help through the public defender's office, through the prosecutor, and I got that help. I got sent to John Brooks Recovery Center long-term. I completed the program. I've been out around 2 months now. And I've learned more in that program than I did in the last 25 years. And you guys are right, it's more than just using, it's getting deep inside what's going on. I've been abused as a kid, I was in foster homes, getting beat, and my counselor, John Brooks, brought that all out of me. And he, to this day, I stay in contact with him every day. He texts me, I text him. And not just these programs like the reentry program, Integrity House, which is a fairly new IOP in Ocean County. I'm involved with them. You know, you can bring the horse to the water, and unfortunately, every horse is not going to drink. You're not going to be able to save everybody. For the people that want it, they're going to get it. I put both foot into my recovery. I'm working now. I'm a certified welder. I'm paying taxes. I'm doing the right thing for my family. I'm doing the right thing for me. And hopefully in time I'll do the right thing for the community.
been a long time doing criminal activity. I turned my life around, and I just want to be a positive member of society for myself and for Ocean County. And thank you, John. I love you.
I can tell you this, a little over 6.5 years ago, one of my treatment vacations to Maryville, and I remember going in there so out of my mind, and Mark grabbed me at the door and brought me in and actually showed me how to work out, and it was that connection. I stayed there, and I could stay there for 30 days, but I stayed there because he grabbed me under his wing. So that's that peer-to-peer. I would do anything for him, and he knows that. So that's how this spirit world works. You know, I'm not here if he's not there.
My question is the county doing anything as far as employment opportunities for people that most people that have addiction problems have been involved with the law in one way or another, and I know that a lot of people do have felony charges, and that's an issue for a lot of people. Once they're done with treatment and they're trying to become productive members of society and filling out application after application, and nobody is hiring them because they have a criminal record. And I know that for me and for a lot of other addicts that's been a discouraging issue, and to get out and be trying to do the right thing, and nobody's giving anybody a chance because you're considered a social pariah at that point.
We do. We have a recovery center here in Toms River that you can come up to. There's reentry program. I see Lindsay in the back. There is a lot of resources that are popping up right here within Ocean County that absolutely we would be able to find something somewhere real fast.
Well, I mean, I'm working now. I've been clean for some time now, but I was just saying that was a source of relapse for me for many, many years.
The legislature passed, and now if you go into drug court, you can get your record expunged.
Right.
Okay, so that can happen. And I know that the governor just recently indicated that he's going to advocate, and the legislature's taken a look at that they're going to allow expungement for certain drug offenses. I'm going to caution you on that. It's not that I don't disagree with you. I do agree with you, but times have changed. Okay. And even though I would support the expungement, it's not what it's built up to be anymore. And I'll tell you why. Because when an employer goes in and they want to find out who you are, they're going to Google your name. And when they Google your name, you're going to see the arrest that took place that's in the Asbury Park Press, or it's in the Star Ledger, or that's been on the patch, or wherever the case may be. And you can't get that expunged. That's the type of thing that needs to help with the education, what the kids have to understand, because kids go on Facebook and they do it and they say a whole bunch of different things, and you don't think that employers are going to be searching that. If you apply for my office, you don't think I'm going to be looking at your Facebook page in college? And if I see you smoking a joint or having a time with the thing, you think that I'm going to be able to employ you in law enforcement with regard to that? So I do agree with you, but expungement isn't what it used to be, because the cat's kind of out of the bag a little bit. And that's a problem for us, because the public wants to know when somebody gets arrested, but then it just doesn't go away. So it's a two-edged sword, and I just thought it'd be fair to mention it that way.
And the other thing is, in both the prosecutor's office and my office, there are federal and state guidelines that we can hire people that have records.
Right, but I mean, for places even like the dollar store or
No,
Walmart, they have that question where if you've been arrested within the past 7 years or something, you could be clean for the past 5 and doing the right thing, but they can still penalize you for that. And I know
I think that's where it comes down to education, though, with everybody.
Right.
I mean, I'm an employer, and I've never checked anybody's criminal record, nor will I, because I get to choose.
Right.
I am surrounded, the best friends that I have are, actively in recovery, and I hire them in a heartbeat. What we're doing through Hope is going to to these business organizations and saying just that, and encouraging them to change their minds. Come meet the people that we love. Come meet the people who are doing all the right things. Right, have made a mistake in their life, and they've now made amends, and I'll bet you'd be a great employee, right? So, all these rules that these corporations have are based on ignorance, though. Okay. So, education.
You know what's amazing? Since for almost 6 years now, real recovery I have never missed a meal. I've never missed a paycheck. I've never, God puts the steps in there for you if you're just seeking Him in recovery. It just works that way. And that's, Lamont's back here 80 days and he's working 80 hours a week. It's there, it works.
No, I know it's out there, but like I said, for me, a lot of times that was a source of discouragement. Now I've been working for 2 years and every day fine.
They're doing the reentry program, which we support, which is really good. That means that when somebody is coming out of jail, that they help them get a job. And there is employers in Ocean County who are employing these individuals, but the problem really is it needs to be expanded, and you're right.
Isn't there a program where some companies get tax deductions when they hire felons?
Not for me.
No?
Just people on parole.
Yeah? In Monmouth County, that's what I believe.
Lindsay could answer that question.
I don't know. To be honest with you, I don't know. But I do know that on Main Street there is the reentry program. It's in the same building. It's the old Fells Reed. I forget the exact address. If you went there, I'm sure that they would be able to tell you whether there's a tax benefit. I don't know whether there is or not.
Okay, thank you.
I work in
This
the
is our last question. Go ahead.
Yeah, I work in the Toms River School District, and I was thinking about, like, wow, what could you tell kids? We have to teach these kids that everybody has a sad story. And there's coping skills that need to happen, because everybody that has been molested or raped or had drugs in the family, I mean, we all have something, but the coping skills really need to be integrated into our school system rather than I don't know, something to think about, because that's the accountability of, you can give that to a 5-year-old. You can say, hey, listen, this is your choice, and this is what's going to happen to you if you make this choice. You know, those type of life skills that our community needs to reinforce at kindergarten, preschool.
Well, I think that's what I'm saying to you. I think that we in law enforcement need to partner up with the educational community, but it needs to be embedded in the program, not just once every semester.
It's not even about drugs, though. It's about depression. It's about
Everything.
Suicidal thoughts.
Look, we have a huge problem with sexting that's going on right now. So the bottom line is that there is a curriculum that can be put together so that kids are put on the right path right from day one. And it shouldn't be something, just like you have so many things, I have English class, maybe it needs to be embedded, in my opinion, in the health class.
Right.
And that therefore they would get it once a week or twice a week, whatever the case may be, so they would understand. So we agree with you.
Yeah,
The problem is convincing.
That had their fathers in jail and stuff, they're all talking to each other. You know, the 5-year-old that had their dad locked up or their mom locked up, and they talk to each other. They really, I'm so surprised what I hear come out of kindergartners' mouth. But they know, and not all the kids know, but some of them do. So I think we have to start very young. I don't know. Okay.
Okay, thank you. Ladies and gentlemen, thank you very much. Denise, thank you.